Welcome to Aging Untold. Sex in our 60s and 70s may look different than in our 20s and 30s, but good sex can happen at any age, and the benefits are worth it. We're talking about increased happiness, improved physical and mental health, and a longer lifespan, just to name a few. There are some challenges and concerns. Dr. Ray, let's talk more about the benefits first, then we'll discuss what changes with sex as we get older.
Well, there are many health benefits with sex in terms of, especially on the heart, because you have increased circulation, cardiovascular, decrease in blood pressure. These are all beneficial. You also have a release of a lot of the feel-good hormones, that dopamine that makes you feel good. You have some of the other neurotransmitters. Oxytocin makes you bond more and all that. And even some of the other ones that decrease pain, endorphins and all that. So it's just an overall feel-good. So I always say, think of sex as medicine without a prescription.
You know, you hear a lot, especially, let's say, women that lose interest in sex. Could that be hormonal imbalance? Could there be a medical thing going on?
Usually there's a lot of medical things going on. So it could be physical, you know, the loss of hormones declining and all that, as well as it could be an early clue to even some medical conditions like some heart disease. You don't have circulation, so you're not really, your thought clarity and all that is off, or anxiety, depression, but it can also be emotional. You know, what are your feelings towards your partner?
Oh, yeah.
Well, and I think, okay, sex and money. Nobody wants to talk about it. The stigma around sex is massive. It's around older people. It's huge.
Oh, because they're not doing it.
Well, you don't know that they're not doing it.
I know they are doing it, but
They are doing, the kids are aghast that they're
kids are
even
like,
thinking about
"Ah."
it. So I had a guy in a community, and he sat me down and he asked me to find him someone he could have sex with. Now I said, you want me to find someone you can pay for sex? And he said, yes. So I know it was awkward and I felt bad, but the bigger issue is, what do people do?
He just wanted to feel good.
Yes.
He wanted companionship. He
wanted
wanted that honestly,
That
that
bonding.
physical and sexual release,
That bonding.
but also that bonding. And
Right.
let's not forget, STDs are more rampant in our senior communities than
Absolutely.
they are anywhere else. The highest numbers are. So while we might think grandma and grandpa, mom and dad aren't doing it, they are. And they may not be doing it necessarily with one partner, because what I've seen, and I have seen this, my eyes, are one guy, one man servicing many females, and that's
Right.
how it spreads so quickly.
Right.
So we have to talk about this, especially when it comes to our age community, to prevent the issues, the STDs, the UTIs, sexually transmitted diseases, and urinary tract infections. We have to, because they're causing great health.
So just like you
Problems.
can have good benefits from health, you can
Yeah.
have the negative if it's not,
absolutely.
you know, in a responsible way.
Negative consequences.
Yeah.
Yeah, if it's, you know, if you don't protect in the correct way.
But it is part of healthy aging and also just being a human. It's part of the human experience.
Yeah, no need to be embarrassed about it. I mean, I think this generation feels embarrassed to talk about it, but it's a real, you don't think they are?
The older generation
The older generation. When I
is
put,
embarrassed.
yeah,
Yes,
exactly.
yes,
And the
exactly.
younger generation is embarrassed to talk about it regarding the older generation. but
regarding
not
the older
themselves.
generation, because they
Yeah.
can't envision
envision,
that
yeah,
older
yeah.
people would even consider.
You know,
getting naked and
everybody
playing.
needs a Dr. Ruth, right?
Right.
Oh,
You need
isn't
to
she
go.
amazing?
I know, amazing. So
Yeah.
I encourage people to go to therapy, get a handle on your libido, and then talk about and get practical advice about where you can find your outlet for that natural human behavior.
Even if it's a one-person party.
That's right.
Yeah.
Just making sure that you're safe and that you're protecting yourself and the hygiene is there, because the lack of hygiene and the lack of cleanliness afterwards is creating all these urinary tract infections and other issues that then lead to
That's right.
dementia-type symptoms and other things that we see negatively. If we can just talk about it openly and get everybody on the same page, then it's like talking to a teenager about wearing a condom or having protection, talking to our age community about doing things with hygiene and protection is equally as important.
And they think protection is for not getting pregnant.
Right. You're not going to get pregnant. You're 80 years old. You're not getting pregnant.
You're not getting pregnant. But
Right.
but the STDs,
That's
Dr.
really
Ray,
real. And the other part to that is orgasms is kind of like a neural hormonal reset.
Sure.
So that makes the brain and the hormones are interacting together in that.
Makes them sharper.
So
Absolutely.
again, for healthy aging,
Healthy
it is
aging.
important, and so
It is
it's worth
important.
being curious and investigating.
Then I've also had some of the men that have come to me and they're like, it's like shooting pool with a rope. Can you help? So, I mean, at that point, at least I've opened that door of giving them an outlet to come and talk, because they're not going just to their physicians and saying,
It's still
things aren't
considered.
working.
It's considered a taboo. Men are just like
oh yeah,
when
it's
the real fact is, when you start to have any kind of erectile issues, that is an early marker for heart disease and
Okay.
other diseases.
Okay.
And that is a silent, like, hey,
That's probably the most important point I want to make, is that men that are in your 30s, 40s, 50s, if you're having a problem, if your man is having a problem, know that it is not just ED that's the problem. There's something else going on. It needs to be addressed, and it can be the heart.
And one of the earliest signs that show up in even young men is loss of spontaneous erections. That is a change.
Oh,
That's
okay.
a change.
The morning.
The morning hoo-ha.
Okay.
Yeah. That loss is, and it can happen as early as the 30s, but it's telling you there's some changes already going on in your vasculature, in your system.
So there's
and all that.
blockages going on that's not allowing that blood flow.
Correct.
So really, if you're having issues with your libido at any level for any reason, medical clearance would be the first step.
Or at least evaluation, we have to talk
evaluation.
about it, or at least mention it.
So we all agree, thumbs
Yeah.
up on sex.
Thumbs up on sex.
Absolutely.
All right, we'll be back with more.